Nurses, I know that a lot of times we have to deal with death in the hospital. It's just something that we've always had to experience and help families through. And a lot of times you can see that as a failure, especially if it was unexpected or there are other dynamics involved. But I want to tell you an experience that I had that put things in a better, or I'd say different perspective. So I worked in the ER. I was a charge nurse one day, and we had a patient, a wife and a husband. The wife was driving and hurried into the ER and said, my husband's not awake. My husband's not awake. So we go out to the car. The husband did not have a pulse at all. So we went and got a stretcher. We brought the husband in, and the wife was absolutely beside herself. She felt so guilty about what was happening because they were on the way to a doctor's appointment and she didn't notice him sleeping right away. And so we get him into the room. We did get a rhythm back. It was very bradycardic. And it was the medicine, the epi, that was keeping him going, basically. And the wife was beside herself with guilt. And so we brought her to the bedside because we need to know, do you want us to continue and prolong things? What would you like us to do? So she was beside herself. She didn't know what to do. She was like, he makes all the decisions for me. I don't know what he would want. I just don't know. And so she was having a very, very hard time with it. And I was charged that day. So I was actually helping with her and making sure everything was going okay in the room. So we bring her, like I said, we brought her into the room. And the doctor, I'll never forget it, the doctor said, go ahead and say your goodbyes. And, talk to him. Tell him what you think and how much you love him. So she starts talking to the patient. We kind of have our, we're trying to look the other way to give them a little bit of privacy as much as we could. And the patient or the patient's wife was like, hey, he's looking at me and he's wording something over the tube. We're all like, what? I mean, this man was asystole and we barely got a rhythm back and it was a very slow rhythm. And the doctor looked at him. Sure enough, he was awake and he was mouthing over the tube. And I'll never forget this because I've never had a doctor do this. The doctor looked at him and said, you passed out in the car. Do you understand what's going on? And he, yes. The doctor said, you're being kept alive by medicine right now. Do you understand that? And he said, yes. And he said, if we stop this medicine, you're going to pass away. And he said he understood that. And then he mouthed over the tube. He said, please let me go and say goodbye. You could tell what he was saying. I've never seen anything like that. And this doctor had enough respect for life and for death that he said, okay, we're going to pull this tube. If I pull this tube, you will pass away shortly after. And the patient was like, okay. So we ended up pulling his tube. And the love between him and his wife, it was just wonderful to watch. And so because the doctor was letting this happen, the husband said to the wife, thank you for taking care of me. You did exactly what you needed to, but I need to go now. I just need to go, but I love you and I can't wait to see you on the other side. And the wife got to talk to the husband. That experience and allowing that to happen was remarkable because it took away her guilt. It took the burden of trying to decide what to do away from her and placed it on him. They got to say goodbye. They got to kiss each other goodbye. Matter of fact, we had him on like a non-breather mask. And he said, I need to take it off. I need to be kissing my wife. But it was just the most beautiful, beautiful thing that this physician allowed that to happen. We were allowed to help with that transition to death for the family and for the patient. And I just think that's just a wonderful thing. I know a lot of times it can be trying when we're dealing with death and the transitioning of the patient, but sometimes it can be a beautiful thing if you just allow it to be, whether you're allowing family in while you're coding the patient, whether it's dimming the lights down, putting Kleenex on the bed, putting the patient's hand out so the family can hold their hand, putting chairs right next to the patient, letting the family talk to the patient, and just having those last few moments with their family, I think are so important. And I just wanted to share my story to give you guys some hope that, this can be a beautiful thing.